Time for our weekly virtual house call about infectious diseases and all things public health. Joining us live is Dr. Isaac Bogoch, infectious disease specialist at Toronto General Hospital. All right, let's get right to it. Let's talk about people traveling, people like squeezing that last little bit of summer vacation still left. Dengue fever is something that travelers should be aware of if traveling to the tropics.
Yeah, absolutely. There's a virus people might not be aware of. It's called dengue virus. It can cause dengue fever. It's a mosquito-transmitted infection, very common in the tropics and subtropics, so that equatorial band around the Earth and on both sides of it. There's a lot of dengue virus circulating right now, and this can cause a pretty uncomfortable infection. People will have fever, muscle and bone pain, headaches, and again, it's preventable. You just have to be aware that it's there. Obviously put on some mosquito repellents to make sure that you don't get bitten by mosquitoes. I think the big picture here is if you're going to go travel, it's smart to see a travel specialist before you go. Get the advice you need. You might need medications or prophylaxis to prevent from getting other infections like malaria, and they'll give you some great tips on what to be aware about and what to be aware for and how to protect yourself from infections and other issues that can occur while traveling, so you can have a fantastic vacation and stay healthy and stay safe.
Absolutely, yeah. And a lot of people either squeezing in that last bit of summer vacation now or thinking about it potentially in December in the winter months. So I'm sure the situation there will be different. All right, now this is something people are talking about. There are various things that people are mentioning about this, but the new COVID-19 variant that people are talking about, BA.2.86, what do you know about it, and how concerned should people be? At least what we know right now, WHO says that they're monitoring it, but they're not too concerned.
I think the WHO is spot on. Something to watch, but we don't have enough information at this point in time. By my last count, I think there's 7 genomes, so it's only 7 isolates of this from, I believe, 4 countries on 3 different continents. What was concerning is the mutations that showed up. And the mutations that showed up were suggestive that, hey, maybe this could possibly cause more infections. It's just not entirely clear. So we don't have any information on how transmissible it is. There's very little information on whether or not this can pack a punch. It's just something that the public health groups are watching closely. We'll have more information on it in the weeks ahead. I think this really reinforces the point that it's so important to have these public health networks that are tracking not just COVID-19, but other emerging infections around the world so that we can have information in real time to inform other people in case there's an emerging issue. It's not quite clear what's happening with this one just yet. It's way too early to see. All this information is based on some genetic mutations in the virus. I think we just need to sit on our hands for at least a couple of weeks until we have some more information.
Right, and so what we're also seeing a lot is, at least, you should always post and ghost at times. Like, I see our CB24 tweet, we talk about this, and then I see the comments below saying, oh, you mean this is coinciding with flu season, right? We're slowly getting back to school, kids are gonna start being inside a little bit more. Is this what we should be expecting for the future to be? When we talk about a new COVID variant, is it just always gonna coincide with the upcoming flu season as well?
Yeah, I mean, let's just be clear. We know COVID is not going away anytime soon. We know it's going to wax and wane for the foreseeable future. We know there's some predictability to it as well, right? We're sadly at the tail end of summer and entering fall. Every year at the tail end of summer, entering to fall, we start to see a rise in cases. And that's exactly what we're seeing now. There's some detection of rising wastewater surveillance. So if you put it all together, you don't need a crystal ball to really predict the future. And quite frankly, not much is new. Right? The diagnostics are the same. The therapeutics are the same. The vaccine still reduces the risk of more severe manifestations of the virus. The way to protect ourselves and others is the same. So yes, the virus might change a little bit as it continues to mutate, but I think the lessons we've learned over the last 3 years still stand, and quite frankly, there really isn't anything new on this front.
All right, Dr. Isaac Bogoch, we had so many questions, so many other things, but we'll have to wait for the next time. Thank you so much for joining us. I do appreciate your time, as always.